4. Role of the guardian and treatment guardian. The role of the guardian is generally that of a decision maker and does not actually have physical custody of the protected person. The guardian's focus is on the incapacitated person and adheres to the following in making decisions for their client: obeys any advance directive, power of attorney, or other written material from when the person had capacity to make decisions. Makes decisions to consent or withhold consent regarding medical or other professional care, other services, placement, and other needs, and is ultimately responsible and accountable to the court. Follows known values of the incapacitated person, involves the protected person, family, friends, and seeks insight from all available sources. Makes decisions based on the best interests of the protected person when reasonably certain substantial harm will result by following the protected person's wishes. Has the same rights as a protected person and is entitled to information and the same freedom of choice. Cannot consent to voluntary commitment regarding mental health treatment. May decide on authorizing disclosure of confidential information such as medical records, and must take care not to disclose information prohibited under the confidentiality laws. The guardian protects the incapacitated person while advancing their dignity, respect, and self-determination based on well-reasoned and principled decisions, and has a duty to keep the client from being a danger to themselves and others, including grave, passive neglect. It is important to be sensitive to the cultural background of the client and to use an interpreter when needed. The guardian keeps their own record for each client and must be able to explain decisions to the average person and to the court. The guardian must not be pressured or be under any undue influence into agreeing to treatment or other matters, and particularly anything that is not within the scope of their duties in the court order. Again, this is a fiduciary relationship, acting in equity and good conscience, with a special trust and confidence, with decisions viewed from the protected person's standpoint. The focus is on the incapacitated person and not on what is the best for the guardian or for others. The guardian should refer to the patient's Bill of Rights, advocate those rights for their client, as well as those rights which apply to the guardian as a decision maker. There must be no conflict of interest with the duty to act primarily for the benefit of the protected person. The guardian may seek direction from the court as required and report significant matters and submit an annual report to the court. The role of the guardian includes many responsibilities, such as interviewing the client, entering a locked unit, appearing in court, consulting with physicians, keeping records, making preparations for when the guardian may not be available, involvement in discharge planning, seeking enforcement orders from the court for outpatient enforcement related to mental health services, and others as needed. The guardian monitors the condition of the client, communicates with the doctors, nurses, social workers, case managers, and others, and should visit the client at least once a month in long-term placement. If the client is non-compliant with treatment after determining the client's reasons, the treatment guardian may petition the court for enforcement of treatment after the client is moved out of the hospital. The guardian may be contacted by telephone for decisions and other matters. The guardian takes the place of the client, including everything to which the client is entitled, such as a copy of the whole written treatment plan. The guardian is to be invited to treatment conferences and be part of the decision-making, approve or disapprove any treatment changes. The guardian is entitled to an explanation of the goals of treatment, the action, side effects, dangers, and expected benefits of each one. The guardian may ask for a second opinion or even a third opinion if needed. must have all of the facts and must not make assumptions unless they are educated assumptions. If the treatment team disagrees with the guardian's decision, that decision may be appealed to the court, since the responsibility ultimately lies with the court and not solely on the guardian or with the physician. Guardians are a check and balance for citizens who are unable to make their own decisions. When a family member is appointed as a guardian, they are no longer just a family member, but one who now has a fiduciary responsibility for the client. Anyone having concerns regarding the decisions or actions of a guardian, such as complaints or grievances against a guardian, either paid or a family member, may first try to resolve the concerns directly. Report it to the judge or court who appointed the guardian and/or to Adult Protective Services. If they work for someone else, report it to their boss. If they are a contractor with the state guardianship program, file a written complaint. If paid through NAMI or FIC-DAC, start with them. If they are certified by the National Center for Guardianship Certification, file a complaint by phone, by email, or on its website. Guardians are an appointee of the court and are not generally liable as a guardian. For example, the guardian is not liable for acts of the incapacitated person solely and is not liable within the authority in the court order, with caution not to perform outside the court order. The guardian must use reasonable care and caution, taking reasonable steps like a prudent person would and in good faith. Good Samaritan laws protect individuals who assist a victim during a medical emergency and medical personnel following normal procedures. But guardians bear liability for their own negligence. This also applies to the mental health treatment guardians, where state law says, a person carrying out the duties of a treatment guardian as provided in this section shall not be liable in any civil or criminal action so long as the treatment guardian is not acting in bad faith or with malicious purpose. Please note that guardians and treatment guardians are decision makers and responsible for arranging for services, but their success depends on the availability of services statewide, such as assisted outpatient treatment, crisis triage centers, inpatient public beds, and so forth. A guardian, treatment guardian, an agent or surrogate under the Uniform Healthcare Decisions Act or under the Mental Health Care Treatment Decisions Act cannot consent to the admission of an individual to a mental health care facility. Instead, the guardian, agent, or surrogate may present the person to a mental health facility only for evaluation for admission. If you are not familiar with mental health treatment, most is provided by professionals and other service providers, and treatment guardians have access to all members of the treatment team, as the client would. Most psychiatric hospitals today use the following professionals: a psychiatrist who has ultimate responsibility for the patient's care, including diagnosis. The psychiatrist prescribes labs, medications, and therapies. PhD psychologist has a more diagnostic role, which is reached by a series of psychological tests and specializes in individual and group therapy. Many are program directors. Psychiatric nurse is licensed to diagnose and treat health deficits or symptoms of a disease or disorder, but not the disease itself, and makes a written client care plan within the first 24 hours. May not prescribe medication, but dispenses that which is prepared by a pharmacist from a physician's prescription. May do both individual and group therapy in a hospital setting, but not in the community. Psychiatric social worker is also licensed to hold groups. Diagnoses the social, educational, financial, habilitation, and self-care needs of the client and suggests therapeutic changes. Expressive therapists include art therapists, dance therapists, recreational therapists, psychodrama therapists. They are licensed and highly trained and assist the physician in making a diagnosis and in treatment. Licensed dietitian promotes health through teaching and individual dietetic choices. Mental health workers assist the nurses and are responsible for the safety of the clients and the staff. May hold community or socialization groups and assist professionals with therapeutic groups. Case managers monitor the needs of seriously disturbed patients in the community. They act as patient advocates and advisors. They typically work for the hospital or the outpatient clinic. They can hold community or socialization groups and assist professionals with therapeutic groups. Appeals of decisions by a treatment guardian may be made by the client or by a physician or other professional within 3 days. The client must be represented by counsel, and the court may overrule the treatment guardian's decision if it is against the best interest of the client. After a treatment guardian is appointed, the client may be compliant with psychiatric medication or treatment and may regain competence to make treatment decisions. A client should only have a treatment guardian when they cannot make their own treatment decisions, and any person must petition the court for terminating the treatment guardianship if they believe that the client has regained competence to make their own treatment decisions. When the court appointment ends, the treatment guardian may petition the court for reappointment if the client is still incapable of making their own treatment decisions. Practically speaking, if the provider, facility, or the DA petitions for reappointment, the court must hold another hearing and may order reappointment if the client is incapable of providing informed consent.